Good morning. I want to go over pelvic tilts and a little bit more review over the pelvic bowl. Typically in Pilates, we talk a lot about the pelvic floor, which is this gathering of muscles that both men and women have on the bottom of their anatomy. Here we have the ischial tuberosities, the pubic bone, and then the iliac crests up here. In the back, we have the L5 S1 junction, L5 L4 right here. These are typical areas where most people do get herniated discs. So we're going to go over some of the pelvic tilt information I go over with most of my clients on their first visit. And a lot of that is just controlling by taking the pubic bone, pushing it up. And I always call this smushing the blueberry. It's just a good review to go over how our breath work impacts these muscles. A pelvic floor therapist is always the best to go over in our anatomy. As a Pilates instructor, I do not necessarily teach clients to do Kegels during their exercise. But let's go over our breath work real quick before we get started. We're going to be using a ball today. Hands go right here on your lower ribs. You're going to take a nice big inhale and exhale. And as you're exhaling, you're trying to wrap those ribs like you're pulling up a zipper on tight pants, pulling everything together. Inhale, everything opens. Exhale. And what you're doing is when you exhale, you're not pushing down, you're pulling up, and you're pulling your navel back to your spine. All right, we're going to work with some roll-ups with the ball. Actually, first, let's lay all the way down. We're going to go over that breath work again, and we're going to go over the pelvic tilt. So as you're laying all the way down, we all have this space underneath our back. With your shoulders rolled down, feet are placed on the mat. You're going to take your lower back and you're going to just pull up. It's a very gentle movement. It's almost like you're pressing the lower back into the mat and rolling out. And then again, pelvic tilt up and then out. I also talk about visualizing a marble rolling up to your belly button and then rolling back down to your pubic bone, which is that bone I showed at the very beginning. All the way up, you're smushing the blueberry, all the way down. Now we're going to take the marble up to your belly button, over to your right hip, back down to the pubic bone, to the left hip. So now we're doing a swirl in this pelvic bowl area. You can also do this sitting at your desk. Reverse the swirl. Let's do 2 to 3 in the opposite direction. And I'm just moving my hand like this because the movement in that lower L5-S1 junction is quite small, so it's hard to see. Do one more pelvic tilt up and all the way down. It should not be a big dramatic one. Grab your ball, place the ball in between your knees. We're moving into a bridge. Feet are hip width distance on the mat. Hands are down by your side. Hands are supporting. Neck is long. Pelvic tilt. So you're pulling your pubic bone up, tucking your tailbone, scooping your abdomen, rolling all the way up to your shoulders. We are not out pooching here. This is nice and tight. Inhale, exhale. It is right here that is setting each vertebrae down one at a time. Tailbone hits. Inhale. Squeeze the ball. Exhale, pelvic tilt. Coming all the way back up. Inhale. Exhale, set each vertebrae down one at a time. Release the ball. Squeeze the ball. Coming all the way back up. Now for my more advanced students, you can take your leg on this next bridge, extend it out. Keep it out before you lift. You're pressing down with the opposite foot. You're going through that same motion all the way up. You can keep doing the bridge as you're doing on the other side. This is really going to turn on your hamstrings. Opposite leg, squeeze, come all the way up. Inhale, exhale, all the way down. Take the ball out from in between your legs. And if you need to pull yourself up, you're welcome to pull here, or you can come all the way up to a seated position. Excuse me. We're going to start with roll-ups. Since I have this mat here, I'm going to use this. Long legs. Same thing. We're kind of rolling all the way down. Inhale. Exhale, rolling all the way up, sitting up nice and tall. Holding onto your ball, squeezing the ball, setting each vertebrae down. The ball can come up over your head. All the way up. Do 2 more. I really like to do this when I'm having back pain. And if you are having back pain, you can always bend here. Slowly roll down and then tuck the chin first. And if you have to get a little assistance coming up, that's okay. All right. From here, we're going to do a ball toss. So we're going to have, you can have your knees bent or your legs straight. More advanced is legs straight. You're going to come all the way down. Hands come back. Now you're going to bring your legs up, pass the ball to your feet. Hands go above your head, feet tap. Come back up, hands tap. I'm going to remove this just so it's not in the way. Exhale, tap the ball. Just keep passing the ball back and forth between your hands and feet. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. If you're getting sore, you can bend your knees for a little bit more of a gentle, but I do want those toes to tap if you are bending those knees. Do 2 more. Okay, come up to a seated position, grab the backs of your legs, come all the way up. Next is going to be roll like a ball. So we are trying to create a diamond shape with our legs here. And I want you to hold the ball in between your legs. Make sure there's no small children or dogs behind you. You're going to squeeze the ball, feet are together, and you are in a C curve with your back. You are turning and curving your back into a C. Just try lifting your feet. And if that's where you're at, that's where you're at. You're holding on to the outer edges of your shins. Inhale, exhale, come all the way up. And you are trying to not lose the ball. Right now I have it in between my knees. Inhale, exhale. And you have your chin in a chin tuck. Inhale, exhale. Inhale, exhale. To advance this, put the ball between your feet and try to keep your feet in. And then try to keep the diamond shape the same distance as you are rolling. And of course, if you have any back pain, back surgery, that may not be the best for you to engage in until you've talked to a professional or your doctor. All right, my dear, the next one, we're going to be doing TikTok. This one you don't need a ball for. This is just to kind of warm up your spine. Legs come into tabletop. Tabletop is 90 degrees knees, 90-degree hips. Hands come out to the side. Drop your knees without shifting. Keep them stacked. Look over to the opposite hand. Inhale, exhale, center. Inhale, exhale, center. Inhale, exhale, inhale, exhale, inhale, exhale. All right, grab the backs of your legs. Come all the way back up to seated position. All right, so now we're going to move into teaser. Teaser can be a difficult exercise. Let's just do the prep for teaser and then we'll go into full teaser. The best way I like to prep is tabletop, tabletop, V, V, and then you slowly open. Inhale, you can even swing your arms here to pull back up into that teaser. Okay? If that's too much for you at the beginning, here, holding the backs of your legs, here, down, down, sitting up, 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 down, down. Now, if you are a little bit more advanced with teaser, put the ball in between your feet. Lift both feet, let go, drop, inhale, exhale. 1, 2, and 3. Lovely. You can do 2 more if you are feeling like that is a good challenge for you for today. I typically do 3 to 4. That's about all we need. All right, we're going to do some side laying kicks. We'll call it a day after that. So the ball is here more as a suggestion. You're going to be on your elbow. This is so you don't get a saggy waist. I want you propped up. The ball is a reminder to stay propped up. So your legs are going to come straight out, stacked. Organize your box, meaning your shoulders and your hips are stacked. From here, lift your leg up. You're planting into this shoulder. Careful if you have shoulder problems. If this hurts, you can remove the ball and lay down. Leg is lifted hip height. Kick forward. Point back. Inhale. Flex foot. Point your foot. Flex foot. Point. Flex. Point. Flex. Point. Flex. Point. Flex. Point. Okay, remove the ball from here. Arm is going to come down. You can rest your hand on your arm. You're going to take the ball. You're going to grab it with the back of your leg. From here, you're going to just take and rotate your knee up towards the ceiling and then back down. 2, 3. Keeping this tight, pulled up here. Hand is here for support. Neck has no tension. You should be feeling that all in the glute area. 6, 7, 8. Okay. Now squeezing the ball here. You're going to be pushing your knee back towards the back wall. 1, 2, 3, 4, 5, 6, 7. Really stabilize here in the hips. Make sure they're not wobbly. 8. Okay. From here, we're going to switch to the other side. Take your ball, moving onto your elbow. Place it underneath your upper rib cage. That is just a good support and a good reminder for you to keep your rib cage up, keep your Pilates breath. Organize your box, keep your hips stacked. You're supporting your shoulder and your neck with this arm being at 90 degrees. Lift your leg hip height. Make sure you feel nice and comfortable. Flex your foot, kick forward, point back. Inhale, exhale. Now I can tell that this side is weaker by the way that my body is moving. So I'm going to work a little bit harder to push my elbow and my anchored hip into the mat just so it has a little bit more support. Okay, this leg comes down. We've done 8. Ball comes out. Come down onto your elbow. Grab the ball with your upper leg. Bend both knees. This hand comes down to your side. And then rotate up. 1, 2, 3, 4, 5, 6, 7, keeping this nice and tight. 8. Okay, now still squeezing the ball, and we're squeezing with about 10 to 20%. You're going to take the ball, lift your leg, hip height. Your knee is now going to be pushing back. 8. 1, 2, 3. Exhale. 4. Exhale. 5, 6, 7, 8, 9, and 10. Oh, sorry. We should have stopped at 8. We just did 10. Okay. Take your ball out from here. We're going to move into our final exercise for the day. This exercise is called Mermaid. This is just as much fun to do with the ball as it is on the reformer. Of course, the reformer is always fun. All right, if you are unable to sit with this knee bent and this knee bent, you can always do a crisscross applesauce sit, but I would prefer this to be here. And then I want you to try to balance your hips. Your hand will come here onto the ball. Your other hand comes up, shoulder blade slides down, neck is long. Your shoulders are not rotating. Your shoulders are moving within one plane. Inhale, exhale. We're arching over. We're getting a nice, good stretch between the elbow that is up and the hip that is down. 3 times. 1, 2, and 3. Leave the ball here. You're going to rotate. This hand comes down. You're going to look up, gaze into your elbow. Now you're feeling a stretch on the opposite hip. Breathe into that. Inhale. And exhale. Both hands come down and over onto the ball. And you're going to kind of cat paw walk it out. And then just pause there. And really push your back heel back and your upper shoulder forward. Exhale, coming all the way up. If you get a little cramp in this hip, that's kind of normal. Just take it, shake it out. Opposite side. Mermaid position. This knee is bent. This knee is bent. Ball comes to the other side. This hand comes up. Shoulder blade is down. Engaging your abs here. And then arching over. And our shoulders are not moving. They're staying within one plane. 2. 3. This hand moves over. This hand comes up. Gaze into your elbow. Inhale. And exhale. Both hands come over. Abs are engaged. Walking out, stretching the back hip out and really getting a stretch in that inner upper shoulder. Exhale, cat paw, walk back up. Take your legs out of this position. And then I always like to finish my classes with one hand on your belly, one hand on your heart. Take a nice big deep breath in. Drop your shoulders. Drop one ear to the same side shoulder. Drop the other ear to the same side shoulder. Think about how you felt before you sat down and gave yourself, 10, 15, 20 minutes. Breathe into that space. Thank your body for everything that it does, and if it's capable to do workouts, that it helped you get through this workout, and that you are feeling better with incorporating a ball into your Pilates practice. All right. Thank you.